you're not broken. This can be stable for the rest of your life. And this can be something that is there, but doesn't have to be symptomatic or cause problems or get worse just because it's begun.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today on the podcast, I have Meghan Pritchard, who works at Specialized Physical Therapy in Mississippi. Meghan is a physical therapist that specializes in pelvic health, and she's also a birth doula. She also has had her own journey with chronic constipation and used pelvic floor therapy to get through that. I hope you enjoyed this episode as we talk to Meghan a little bit more about the pelvic floor. Hey, Meghan, I'm so excited to have you here today on the podcast. This is really awesome because I know that you are a pelvic floor therapist and you are here in Mississippi. I would love for you to introduce yourself, tell us how you got into what you do, and a little bit about your story.
Sure. Well, I'm Megan. I have been a pelvic health PT for about 5 years. When I started PT school, I didn't know what pelvic health or women's health was. It's kind of gotten a little more publicity in the last few years, I feel like, and that's exciting. But on my first clinical rotation, the clinic that I was with had a PT who was doing just a little bit, like 1 or 2 days a week of pelvic health. So that was my first exposure to it. And it was like a whole new world. I just fell in love with it. And I'm passionate about helping people who have problems that they feel like they can't talk about. Like anything that falls into the category of TMI is my jam.
Yes, I love it. I'm kind of like that too, in a way, with the gut health thing. So,
It-
yeah, I like that. So, what was it that specifically interested you about pelvic floor PT and made you actually want to get a career in this?
yeah. So in my first year of PT school, around the same time that I was doing that first clinical rotation, one of my best friends got married. I was a bridesmaid in her wedding. And a couple of months before she got married, she came to me and said, I am super nervous about having sex. She'd never been able to use tampons because it was so painful. And her doctor had told her to start with trying to insert a lubricated Q-tip. And she had been unable to insert a lubricated Q-tip. And when she told me all of this, I was like, what are you talking about? I've never heard of anything like that. But that is pelvic floor dysfunction. That is a diagnosis we call vaginismus. It is a reflexive contraction of the pelvic floor muscles in anticipation of penetration. So a lot of times it's sex, but it also can be tampon. That's usually an early sign, and pelvic exams. So none of those things should ever be painful. And if they are, chances are we've got something going on with your pelvic floor. So I was super excited when I started that clinical rotation and got exposed to that on the clinical side because I was like, this is the answer for my friend. And then I was further interested because there is a huge overlap in the pelvic health world with musculoskeletal dysfunction and the sort of psychosocial stuff. An example of that is with vaginismus, the diagnosis I was just talking about. It's in the DSM as a psychological diagnosis as well as the pelvic floor dysfunction diagnosis, because it often goes along with either a fear of penetration, trauma, or general PTSD sort of fight or flight response. So I think it's really cool how the psychological affects the physiological and vice versa.
Yeah, that really is interesting. So, were you able to help your friend then?
Yes, she lives far away. She lives in a different state, so I didn't get to work with her one-on-one as frequently as I would with a patient who was here. But yeah, she saw a ton of improvement.
That's awesome. You were talking about the mind body connection and how that can affect even your pelvic floor. How does the pelvic floor affect gut health?
Yeah, I always tell patients that your pelvic floor and your pelvic organs are besties. They do everything together, they get mad together, they go to the bathroom together because the pelvic floor is shaped like a little bowl and all of your pelvic organs sit down in that bowl. So they're essentially touching each other. If one gets mad, the other gets mad. So if we've got some inflammation going on with some of those organs, it's going to make the pelvic floor more prone to being tight or tense or having some dysfunction, and then vice versa. If pelvic floor muscles are not working correctly, then they control the output of bowel and bladder. So if they're not letting things out or keeping things in appropriately, that's going to change the way that organ functions.
Yeah, that's so interesting. I mean, like, it all makes perfect sense. It's just it's interesting to remember and think about how everything in the body is connected. You were talking about people that do have incontinence or maybe even chronic constipation. How does chronic constipation affect the pelvic floor?
Chronic constipation is the root of all evil.
It sounds like it.
For other reasons besides your pelvic floor. But on the pelvic floor side, if you have chronic constipation and you spend a lot of time either sitting on the toilet and just waiting and waiting, that's a ton of pressure on your pelvic floor. Or if you're sitting on the toilet and straining, that's a ton of pressure on your pelvic floor. Or if you're not even trying and you're just walking around with a week's worth of stool in your pelvis because you don't have a bowel movement regularly, then that's a lot of pressure on your pelvic floor. So all three of those things are just pressure on those muscles. And it's like chronic strain. So if you had to hold a 5 pound weight in your hand for a few minutes, no big deal. But if we have a 5 pound weight in your hands for a week, then your muscles are going to get tight. They're going to get fatigued. They're not going to be able to do their job appropriately because they're just holding on to all this weight all of the time. A lot of the people who chronic constipation is the first thing that they had. And then over time, like that's not even what they're coming in for. They'll come in and say, oh, I'm having urinary incontinence. But then when I start asking questions, the first thing that showed up 10 years ago was constipation.
Wow. So I know that Megan, you said previously to me that you have had chronic constipation in your life. How did that affect you, and what did you learn through that?
Yeah. So patients tell me this all the time, and it makes me laugh because I said the same thing at one point in my life. I didn't know it wasn't normal to only poop once a week because it's a thing that we don't talk about. So all through my teenage years, I would have bowel movements once or twice a week. I just thought that was completely normal until I got probably halfway through college and really into PT school when I started being mindful about making sure that that happened. So when I got interested in pelvic health in PT school, I took the entry level pelvic floor course because we don't learn how to treat the pelvic floor in PT school. It's something that you have to take continuing ed for after. So I'm like 23, 24, going into this weekend course and we're learning how to do pelvic exams for the first time. So one of the things that PTs looks for when we do pelvic exams is pelvic organ prolapse. So pelvic organ prolapse is where your organs start to sit lower in your pelvis or start to protrude through the vaginal opening a little bit if it's severe. And I've had 0 babies in my early mid-20s. And the first girl who does my pelvic exam is like, yep, you have a grade 2 prolapse. And I was like, what do you mean? I'm I've never been pregnant. I haven't had any babies. I, I should not have a grade 2 prolapse. That was my light bulb moment of, oh, it's because I've been constipated my whole life and I've been straining. So I didn't have to have a baby. I didn't have to have 4 pregnancies.
So, what did you do about that? Like, you put 2 and 2 together pretty quick because you were in school for this. And so once you
Mhm.
found out that you did have this grade 2 prolapse and you were like, "Okay, it must be because of the chronic constipation because I'm figuring out now that I actually have been constipated."
Yes, so that's probably when I really started to prioritize making sure I would have a regular bowel movement. And I did a lot of what I teach my patients is routine. Bowels love routine. Bowels love people who like routine. I increased my water intake. I watched my fiber intake and made sure I was getting kind of the right types of fiber. I started eating breakfast regularly at the same time, getting physical activity regularly at the same time, and then just being mindful that I should be having a bowel movement every day or every other day. And if I'm not, then I need to check in. What's going on? Am I not getting enough water? Am I not getting enough physical activity? Am I stressed? What's going on in my life?
Yeah. So was that particularly difficult for you to get to a place where you were having regular bowel movements, or was it more just about, like, the discipline of making sure that you were in this routine?
I think it was more about the discipline. Yeah.
That's interesting. So I know that you do have a son now. How did the pregnancy affect your pelvic floor?
Yeah. So when I was pregnant, I could notice symptoms related to prolapse more. So prolapse can be symptomatic or asymptomatic. We have 4 grades of prolapse. Grade 1 means something moves a little bit. Grade 2 means if I bear down, it comes about to the level of the opening of the vagina. 3 means it's coming beyond the opening of the vagina, and grade 4 is like we need surgery. There's a huge thing protruding out of the opening of the vagina. We can sometimes decrease the amount of prolapse we actually see, but a lot of times what we're really doing is decreasing the symptoms related to prolapse or changing the way your body's reacting to that prolapse. So with a rectocele, which is common with constipation, the rectum is what we see starting to droop down in the pelvis, and it creates like a little pocket where stool can get backed up. Basically, so a symptom of rectocele is feeling incomplete emptying or feeling like there's something right there and I can't get it out. It feels like I'm not pushing the right direction. So I felt that more during pregnancy because I had a baby sitting on top of my rectum. But then postpartum, it's not been as much of an issue anymore. So I still have a grade 2 prolapse if you check me, but I don't have symptoms from that grade 2 prolapse, which I'm grateful that I have that history because a lot of times patients are terrified of prolapse. They come in and they're like, oh my God, my life's over. I can't pick up anything heavier than 5 pounds for the rest of my life. I can't do any sort of crazy exercise or physical activity. I can't pick up my baby. And I love to be the one that says, you're not broken. This can be stable for the rest of your life. And this can be something that is there, but doesn't have to be symptomatic or cause problems or get worse just because it's begun.
Yeah. So when somebody does have a prolapse like this, is there any way to completely resolve it, or is it just kind of, let's make sure it's asymptomatic?
So, in the research, we can improve the grade of the prolapse with therapy. But I like to always start off therapy saying that's not my goal. My goal is to improve your symptoms and how it's affecting you. Because some of that might be genetics and the flexibility of your tissue maybe will decrease the actual prolapse that I can see with my eyes. But if you're walking around with a technical grade 2 prolapse all the time, but it's not affecting your life in any way and it's not getting worse, then that's a win to me.
Yeah, for sure. So, what are the biggest reasons why you see people in the area come to you?
Constipation is a big thing. And sometimes it's something that people don't, like I said, they're not coming in for constipation. Pain with sex is something that we see a ton. That's a Mississippi thing. People everywhere can have pain with sex, but we live in the buckle of the Bible Belt here, and pain with sex is twice as common in evangelical women.
Really?
Yeah. So
Okay. Why is that? Like, where's what?
Yeah. So
That's
start by saying, I'm a believer.
I am as well, yes.
So God doesn't hate sex. He invented it.
Right.
But a lot of times in the church, we don't do a good job of talking about sexual purity in a way that doesn't create shame. And shame to your body is a fight or flight type of response. So I talked about that psychological connection, right? If you have a fear of penetration, or if your body is saying this is dangerous, then you're more likely to have that contraction of the pelvic floor that's going to result in pain when you try to insert. So people who grow up in a household where the only message they ever get about sex is it's bad. Don't do it. You'll get pregnant. Never do it. Or we don't talk about that. We don't talk about sex. That's a taboo, off limits topic. And the only message you ever get is either nothing or bad. Then, my friend, when you get married and you have no prior experience, the message to your body is this is dangerous.
Right. Oh
Yeah.
my goodness. Once again, it makes total sense, but that just blows my mind. And I think that that is something just talking about these things, anything, but especially women's health, pelvic health, your gut issues, all these things that people think, oh, they don't need to talk about or they don't want to talk about. There are people like you and me who do this now because we went through it and we're talking about it. And it's like, you don't have to be ashamed, right? You just have to find the right person to talk to. But that's just so interesting. Do you get a lot of people that have never been to pelvic floor therapy and really don't know what to expect? Can you just kinda talk me through that for the listeners that had no idea what to expect?
Yeah, it's kind of scary for a lot of people coming in on the first time because they don't know what to expect. So I like to slow down that first visit at 10, and I usually spend 30 minutes talking at least before I ever do any kind of exam. So you come in, you tell me your story, and then I ask you a million more questions just to get all the details, find out things that you thought were normal that are not normal, or things you didn't think might be relevant that could be relevant. And spend another 5 or 10 minutes going over what is the pelvic floor? What does it look like? What does it do? What is it supposed to feel like when you do various activities? And what's it look like on the outside and the inside? And what do I think, just based on talking to you, might be going on that's causing your problem? Which I could be wrong. And then that's usually what I say. So to verify my hypothesis, what I'd like to do next is a pelvic exam. And then I walk you through this is what the pelvic exam looks like. Are you okay with all of that for today? And sometimes people tell me no. Not usually. Most people are fine with it once we get to that point. But because sometimes people don't know what to expect, they come in and they're like, wait, you want to do a pelvic exam today? Nobody prepared me for that. My doctor didn't tell me that. The internet didn't tell me that. I didn't think about that being on the agenda today. Can we do that next time? And that's completely fine.
Yeah. So, do you see men also?
Yes, we've got 3 therapists and 2 of us treat males. So I don't have nearly as many male patients as I have women. Some of that is because women are more prone to pelvic floor dysfunction because of our anatomy and because of lifestyle factors like men don't have babies. And some of that is awareness. So I'm starting to get some more male patients in the last couple of years as the doctors in the area are starting to realize that it's beneficial for men too.
Yeah. What are some of the biggest reasons why male clients would come to you besides chronic constipation? And I guess I'm asking too because as much as women don't talk about this, I think men even more don't talk about it.
Yeah, one of my most awkward moments with a patient ever was a low back pain male patient. So he wasn't coming to see me for pelvic floor, but 100%, he should have been a pelvic floor patient. I think his low back pain was due in large part to his pelvic floor being tight. And so I tried to teach him how to use his transverse abdominis or your deepest layer of your ab muscles that work together with the pelvic floor. And he just was not getting it. And so finally I was like, okay, my last ditch effort on anybody who can't figure out how to turn on this ab muscle is to do a Kegel. And he was like the stuff that women do. I was like, well, you have a pelvic floor too. And he's like, I have a pelvic floor. And then he was like, let's never talk about this again. So yes, men have a pelvic floor too. Everybody who has a pelvis has a pelvic floor. Men's pelvic floor has the same functions as women's pelvic floor. And so they have a lot of the same symptoms like constipation or urinary hesitancy or incontinence, but then they do have some things that are specific to them. So they have a prostate and we do not. And that ties into pelvic floor PT in two different ways. So I see a lot of men who have prostate cancer after prostatectomy. So after they've had surgery to that area, anytime we have surgery anywhere, we get scar tissue. It changes the way the muscles and the connective tissue in that area function. So a lot of times after prostate cancer, after prostatectomy, men will get urinary incontinence when they've never had it before, or pain in that area, or sexual dysfunction, either erectile dysfunction or premature ejaculation. And then on the other side of the prostate issue, we have chronic non-bacterial prostatitis. This is misnomer diagnosis because a lot of men get diagnosed with this chronic prostatitis, and it's called non-bacterial because there's almost never an infection in the prostate. The prostatitis, the word itself means inflammation or infection of the prostate. But most of the time, people who have that diagnosis really have pelvic floor dysfunction. The prostate's an innocent bystander that gets all the blame because they feel it sort of deep in their pelvis. Urinary frequency and urgency, sometimes urinary hesitancy and pain throughout the pelvic region, that's really all coming from pelvic floor dysfunction. So anybody who has the diagnosis of chronic non-bacterial prostatitis or interstitial cystitis, which is kind of a female version, or chronic bladder pain, there's not necessarily an infection in the bladder. Both of those diagnoses should be seen by a pelvic floor PT. There's a good body of evidence that says those patients, regardless of what else they're doing on the medical side, should be seeing a pelvic floor PT. It makes a huge difference for a lot of people. And we get some, but I think there are still a lot of doctors who just don't know what we do.
Yeah, I would agree with that. It makes complete sense to have a specialty area for those specific muscles whenever regular physical therapy doesn't really address those specific muscles. I think that it's such an important thing. Also, I'm so fascinated by all of it. Megan, this has been an awesome conversation. I have appreciated all of your insight and the information you've shared with us. I'll be sure to put your Instagram in the show notes in case anybody wants to connect with you around here. And it has been awesome having you on the podcast today.
Thank you so much for having me on.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.